If you've ever been told that pacifiers cause stomach problems, nipple confusion, or will harm your baby, especially by someone well meaning, then this video is for you. I had the same warning during my home pregnancy, and today I want to gently separate medical fact from cultural myth. Pacifiers do not cause stomach problems in healthy babies. They do not affect digestion, cause reflux, gas, or stomach problems. What pacifiers do is to trigger a natural sucking reflex, which is actually common for babies. Not using pacifiers in the past does not mean they are harmful today. Medical guidance evolves. Pacifiers are now safely tested, and we now understand infant soothing and sleep much better. Please note that respecting tradition does not mean ignoring science. For most babies, pacifiers do not cause nipple confusion, especially if breastfeeding is already established. However, very early introductions or in babies struggling with latch, then it may be necessary to delay the use of pacifier. An important tip is to delay pacifier use until breastfeeding is going well and well established. Dental issues may occur only if pacifier use continues beyond 2 to 3 years or is used constantly day and night. Short-term use in infancy is safe. Risk increases only if pacifiers are in the mouth for most of the day, thereby limiting opportunities for babies to babble and interact. It is important to encourage talking, playing, and pacifier-free awake time in babies. Babies cannot be spoiled by comfort. They use pacifiers to self-soothe, which supports emotional regulation and does not create dependency. These benefits are supported by pediatric and public health bodies. Problems could arise when pacifiers are overused, and the risks include ear infections, dental alignment issues, and delayed weaning. Here's a checklist for safe pacifier practice. 1. Introduce after breastfeeding is established. 2. Use only BPA-free one-piece pacifier. 3. Clean and sterilize regularly. 4. Use mainly for soothing, sleep, or distress, not to delay feeds. 5. Begin weaning at around 12 months. As parents, especially mothers, we are often told things confidently that are simply not true. Pacifiers do not cause stomach problems and are safe when used appropriately. You choosing to use one does not make you less informed. It makes you intentional. Always ask, is this advice based on evidence or fear? Your baby deserves calm and informed care, and so do you. If you found this video helpful, please like and subscribe. This will help my channel to grow, and this will help to spread this information to more people. Thank you so much for watching. See you in the next video.